In class, so at the side is the transcript of our discussion. Okay. Started. So where's the transcript? Hello? Okay. So before we begin, let us start with the prayer. Psalm 23. The Lord is my shepherd. I shall not want. He makes me lie down in green pastures. He leads me beside still waters. He restores my soul. He leads me in paths of righteousness for his name's sake. Even though I walk through the valley of the shadow of death, I will fear no evil, for you are with me. Your rod and your staff, they comfort me. You prepare a table before me in the presence of my enemies. You anoint my head with oil. My cup overflows. Surely, goodness and mercy shall follow me all the days of my life, and I shall dwell in the house of the Lord forever. Amen. Okay. So, good morning, class. Our topic for today is all about the medical ethics manual, okay, which was drafted and passed by the World Medical Association. So, this medical manual class is considered to be one of the basis for medical ethics, okay, because this came from the World Medical Association, okay, which is considered to be one of the international organizations for medical ethics and other declarations. Okay, remember the our discussions with human research, the Declaration of Helsinki, and other guidelines. Okay, the Lisbon Declaration, Taiwan Declaration, Tokyo Declaration. Okay, so they are considered to be an authority in the medical field. Okay. So today, our discussion is all about the World Medical Association Medical Ethics Manual, third edition, 2015 version. So we will cover first the table of contents in this manual. Okay. So first is the acknowledgement written by the Secretary General, forward and acknowledgements, which was written by the World Medical Association officers and the Secretary General. And then next, we'll discuss introduction with regards to medical ethics. Okay, why we need to study medical ethics, especially at this time. Next, medical ethics, medical professionalism, human rights, and the law. Okay, so this is like the encompassing topics that we need to discuss, because like what I said earlier, medical ethics is a broad topic, far-reaching, encompassing. So there are many aspects, many attributes, okay, that needs to be discussed. And then after that is the conclusion in this chapter. Next, chapter 1 talks about the principal features of medical ethics. So we will be discussing the preliminaries, like its objectives, what's special about medicine. Okay, you are medical students. Of course, you aspire. You are an aspirant of becoming a medical doctor, a physician. Okay, so what's special about medical ethics? Its essence, its pros and cons, okay? Then who decides what is ethical? Okay? Who has the final say? Who is the arbiter of what is ethical, what is not ethical? And does medical ethics change? Okay? Is it dynamic? Okay, is it traditional? Then does medical ethics differ from one country to another? Okay. Remember our discussions last time. It is a case-to-case basis depending on the authority, depending on the country. Okay. Next, what is the role of the World Medical Association with regards to ethical consideration? Then how does the World Medical Association decide what is ethical? Okay, what guidelines they use? Okay, so remember the different declarations we discussed last time. So these are the guidelines, okay, promulgated by the World Medical Association to guide different countries, different organizations, different institutions on what is ethical, okay, how medical ethics is applied, what are the pros, what are the cons. Then how do individuals decide what is ethical, okay? And then the conclusion in this chapter. Chapter 2 talks about the physicians and patients, okay? Um, Remember, class, that this ethics manual is already integrated in the professional responsibilities for doctors that we discussed last time at the beginning of our subject. Okay, so some of these topics are integrated. Okay, basically that guideline, the ethical guideline for Philippine doctors, are some of its provisions are copy paste from the different guidelines from international organizations like this one, okay, from the World Medical Association. Okay, so chapter 2 talks about physicians and patients. So we'll be discussing its objectives, a case analysis, okay, a scenario is given, and then we will conduct a study of the case so that we will arrive on the ethical consideration. Next is what's special about the physician-patient relationship. Last time we discussed that the relationship between physician and patient is based on mutual trust and confidence, okay? So this is termed as fiduciary in character. Then we will discuss respect and equal treatment, okay? So whoever you are, whatever your status in life is, one ethical consideration is respect for life, okay, remember, and then equality. So whether you are the president or just the janitor, then you must treat them as co-equal, okay? So our previous discussion, we talked about equality, about respect for human dignity, compassionate service, okay, co-responsibility, solidarity. Okay, we discussed that. Simplicity, commitment to excellence, and then social commitment to your fellow men. Okay, so last time we also discussed that the aim, the doctor is considered a friend to mankind. Okay, so we'll be discussing all that in this chapter. And then we will be discussing communication and consent, decision making for incompetent patients. So we discussed that last time also. And then we will discuss confidentiality. Okay. And then we will also be discussing the beginning of life issues. So last time we discussed about abortion, okay, about euthanasia, issues about birth control. Okay, so we will be also touching those topics in this manual. Next, end of life issues, and then back to the case study. which is the scenario that this manual will give. Okay. Chapter 3 deals about physicians and society. Okay. So once again, its objectives, then a case study is given. Then we will talk about what's special about physician and society relationship. Okay. Remember last time we discussed the what you call this, the physicians has an obligation to its community. Okay, so if you are a doctor, you have an obligation to your community. Next, we will discuss dual loyalty. Another topic, resource allocation, and then public health, global health, physicians and the environment, and then we will touch again the case study of this topic. Chapter 4, we will discuss your responsibility as doctors to your colleagues. Okay, physicians and colleague. So once again, it's objective, and then we are given a case study, and then challenges to medical authority. Okay, remember that in the Philippines, you have an organization, okay, for doctors. And there is also a board of medicine which will handle the administrative aspect of your practice. Okay, for example, you committed a malpractice. Remember the three-pronged liability of a doctor. You can be held administratively liable, civilly liable, and then criminally liable. So, administrative liability, the highest penalty is the revocation or removal of your license to practice. Okay? Civil liability, you pay monetary damages to the victim. Criminal liability, you are imprisoned. Okay? So those are the three-pronged liability when you become a licensed doctor. Next, relationship with the physician, colleagues, teachers, and students. Okay? Professional relationship class. Okay? Next, reporting unsafe or ethical practices. For example, you know your colleague, your classmate, for example, you were classmates in medical school, and then through the years you became doctors, okay? But you know your classmate is um, very incompetent. Okay, it's a miracle that he passed the board examination. So because of certain practices of your classmate, so it's your duty to the community or to the profession that you report the unethical practices of this colleague, because it can cause damage to the image of your profession. Remember, the practice of medicine, being a medical doctor, is one of the noblest profession there is. Okay? Because you are handling life. Okay? Unlike lawyers like myself, I only handle documents. So if I make a mistake, my client gets in prison. Unlike you, if you make a mistake, your patient dies. Okay? So you are placed in a higher pedestal compared to other profession, because you are handling life. Life being the highest right. Okay, remember our discussion, the constitutional guarantee that life in the hierarchy of rights, life is the highest right. Okay? Next, relationship with other health professionals. And then cooperation. And then conflict resolution. And then back to the case study. Next class, we will be discussing medical research. Okay, so if human research, remember the Helsinki Declaration. Okay, so we will be discussing its objectives, and then a case study is presented again, and then the importance of medical research. Okay, it's very relevant, especially at this time where there is a pandemic. Okay, right now there's a new variant, the Omicron. They said that this variant is very infectious, and maybe we will go back to lockdowns. Okay, some countries are already blacklisted because of the virus. So we will just wait and see. Okay, we'll just place our faith to the to our scientists, to our doctors. Okay, and we should be vaccinated, class. Okay, vaccinate ourselves as part of our social responsibility to other persons. Because if you don't vaccinate yourself, of course, you will be, more often than not, you will be a carrier. Okay, you will be exposed to the virus and you will spread the virus. Okay, so that's why, and if you are infected, of course, your life would be in danger. Okay, so that's why we need to encourage vaccination. Right now, we need to have our booster because they said, I don't know if this is true, that the vaccine will expire after 6 months. So it's as if you were not vaccinated after 6 months. So I don't know if that is true. So to be safe, to be at the side of caution, so you might get a booster shot. Okay. Next, we will discuss the research in medical practice and then its ethical requirements. Ethics Review Committee. Remember, our school, the Gulyas College of Medicine, is making a board, an ethical board committee. Okay, Dean and I are making the finishing touches. So after that, if you will make a research, then you will present it to us as part of the board. Dean said the chairman will be him or me, and then the boards will be depending on who we choose. Okay. Next, we'll discuss scientific merit. We'll discuss social value. And then risks and benefits. Very basic. The doctrine of informed consent. Remember, class, your license will be in danger if you will not comply with this requirement of law. Okay? Informed consent. So brush up on your health teachings. So in every invasive procedure like operation, explain it to your patient. Explain the pros and cons. Okay, what will happen, the procedure process. And then if the patient understands and consents with the procedure, let him sign the informed consent form. Okay, because if there are adverse reaction or if the patient dies due to the operation, then of course a case will follow. So this is a protection not just for the patient but for yourself also. Okay? Then confidentiality, the Data Privacy Act of 2012, you must comply. Otherwise, you can pay as much as 5 million if there is a breach of confidentiality. Okay? Next, conflict of the roles. Okay? Remember what we discussed last time, especially when you are a doctor who works with pharmaceutical company, conflict of interest. Okay? The guideline is the best interest of the patient takes precedence over your personal interest, commercial interest, and so on and so forth. Okay? And then honest reporting of results. Okay, one of your classmates asked about honesty. Okay. Next, whistleblowing. Okay, then unresolved issues, and then back to the case study. Chapter 6 of this manual is about responsibilities and privileges, excuse me, of physicians, and then responsibilities to oneself, and then the future of medical ethics. So, chapter 6 is the conclusion. Okay? Sorry for that. Okay. So chapter 6 is the conclusion class. And then there are addendum in this manual. Appendix A is the glossary, includes words in italic print in the text. Appendix B is medical ethics resource on the internet. Please check it out. Appendix C is the World Medical Association, its resolution on the inclusion of medical ethics and human rights in the curriculum of medical school worldwide. Okay, remember class that this international organization is considered an authority. Okay, so all resolutions, all declarations are being followed by different medical organizations, different school organizations with respect to practice of medicine, different hospitals, okay, all allied medical associations. So they follow this as a guideline. And World Federation for Medical Education, global standards for quality improvement, and then basic medical education. Appendix D class is strengthening ethics teaching in medical schools. So that's one of my obligation as your teacher in medical ethics. It is incumbent upon me to deliver to the students, medical students such as yourselves, the basic ethical consideration. Okay? And then Appendix E is additional cases for case study or case analysis. So acknowledgement class, these are the stakeholders, the different officers of the World Medical Association. Okay, so just make a rundown. Okay, from different countries, South Africa, Scotland, Australia. Okay, different officers, stakeholders, members, okay, from all over the world. And then forward by Dr. Dillon Human, the Secretary General of the World Medical Association. Okay, so let's just make a rundown. So in his speech, what is important is to put the patient first. Okay, your obligation, class, is to the patient. The best interest of the patient must take precedence over your personal, commercial activities. Okay, because your duty is primarily to the patient. Okay? So don't make your patients a guinea pig for pharmaceutical company. Okay? Or a milking cow for pharmaceutical company. Okay? For example, your patient has a chronic condition. And of course, if there is a chronic condition, there is a maintenance of medication. Okay? So pharmaceutical company will do everything to make that their one of their persons who will buy their medication for life. Okay, remember, they will buy it for life. So it's like a single patient is like a bank account, okay, to the pharmaceutical company. Okay, they have a client for life. So that's dangerous, class. Okay, so always take note to put the consideration of the patient first. Okay, because the mindset of some doctors, if you treat the patient and then the patient gets better, you lose a client. Okay, that's the mindset of some unscrupulous doctors. However, if your patient, you just treat the symptoms, but not the disease itself, then you will have a patient for life. He goes back again and again. That's wrong, class. That's a wrong mindset. Okay. Now, let's start with the introduction. Okay, of what is medical ethics. So I know, class, we have discussed this time and again, but this is the ethics manual, so we will be covering this until the end of this manual. Okay? So what is medical ethics? First, consider the following medical cases which could have taken place in almost at any country. Okay? So here is a scenario, class. And then your knowledge will be put to the test, whether or not you respond ethically. So first scenario, Dr. P, an experienced and skilled surgeon, is about to finish night duty at a medium-sized community hospital. A young woman is brought to the hospital by her mother, who leaves immediately after telling the intake nurse that she has to look after her other children. The patient is bleeding vaginally and is in a great deal of pain. Dr. P examines her and decides that she has had either a miscarriage or a self-induced abortion. He does a quick dilatation and curettage and tells the nurse to ask the patient whether she can afford to stay in the hospital until it is safe for her to be discharged. Dr. Q comes in to replace Dr. P, who goes home without having spoken to the patient. Okay? So this is the scenario, class. What do you think are the ethical implications or ethical consideration in this scenario? Okay? So we will discuss its ethical consideration as we move along in this manual. Okay? So first, I will read the different scenarios which the ethical consideration we will learn as we discuss deeper in this manual. Another scenario, Dr. S is becoming increasingly frustrated with patients who come to her either before or after consulting another health practitioner for the same ailment. She considers this to be a waste of health resources as well as counterproductive for the health of the patients. Okay, so in this situation, the patient is having second opinion. Okay, so he goes to a doctor, and then when there is a finding, the patient goes to another doctor. Okay, for second opinion. But in this situation, Dr. S thinks that this is a waste of health resources. Okay, so I will continue reading the scenario. She decides to tell these patients that she will no longer treat them if they continue to see other practitioners for the same ailment. She intends to approach her National Medical Association to lobby the government to prevent this form of misallocation of healthcare resources. Okay? So what do you think are the ethical consideration in this scenario? Okay? So we will discuss as we go on to other topics. Another situation, class, is this one. Dr. C, a newly appointed anesthetist in a city hospital, is alarmed by the behavior of the senior surgeon in the operating room. The surgeon uses out-of-date techniques that prolong operations and result in greater post-operative pain and longer recovery times. Moreover, he makes frequent crude jokes about the patient that obviously bother the assisting nurse. As a more junior staff member, Dr. C is reluctant to criticize the surgeon personally or to report him to higher authorities. However, he feels that he must do something to improve the situation. Okay? So, in this scenario class, a junior doctor having conflict with a senior doctor, okay, because of the character of this senior doctor. Okay, so what are the ethical consideration that comes to mind? Okay, are you obliged to report it or not? Okay, we will discuss that as we move along. Okay, so last scenario class is this one. Dr. R, a general practitioner in a small rural town, is approached by a contract research organization or CRO to participate in a clinical trial of a new non-steroidal anti-inflammatory drug or NSAID for osteoarthritis. She is offered a sum of money for each patient that she enrolls in the trial. The CRO representative assures her that the trial has received all the necessary approvals, including one from an ethics review committee. Dr. R has never participated in a trial before and is pleased to have this opportunity, especially with the extra money. She accepts without inquiring further about the scientific or ethical aspects of the trial. Okay? So in this scenario class, there is commercial opportunity. Okay? So what is the ethical consideration involved in this scenario? Okay? So we will discuss those ethical consideration class as we dig deeper to the contents of this ethics manual. Okay? So each of these case studies invites ethical reflection. Okay? So as a medical doctor, as a practitioner of medicine, you apply all your knowledge with regards to the different situation. So it invites or it needs ethical reflection on your part. They raised questions about physician behavior and decision making. Okay? So last time class, we discussed on how to act. Okay? If you are a physician confronted with an ethical dilemma, okay, how to approach, how to act in that situation, how to decide. Okay? So not scientific or technical questions such as how to treat diabetes or how to perform a double bypass, but questions about values. Okay? Take note class that the scenarios that we discussed above or that was given above involves not technical knowledge but values, okay? Values or character of the physician. So rights and responsibilities. Physicians face this kind of questions just as often as scientific and technical one, okay? So when you become doctor's class, within the course of your practice, you will be confronted with all kinds of ethical dilemma, ethical issues. So it's up to you, okay? It is incumbent upon you as doctors to apply what you learned in your practice or in your medical school or as a person, okay? On how to approach certain issues, okay? For example, last time we discussed about abortion. Remember, in the Philippines, abortion is illegal. Okay? In other countries, medical abortion is accepted. So it really depends on the doctor class, on his upbringing, on his knowledge, on his commitment, okay, on his background, on his religion, and so on and so forth. Okay, so it is a case-to-case basis class. For me, there is no right approach. Okay, it's up to you. It's really up to you on how you deal with the situation. So in medical practice, no matter what the specialty or the setting, some questions are much easier to answer than others. Setting a simple fracture and suturing a simple laceration pose few challenges to physicians who are accustomed to performing these procedures. Okay, unlike technical knowledge, for example, there's a person who has a fracture and you are a surgeon, so the procedure is just to perform surgery. Okay, unlike technical knowledge, ethical knowledge is broader class. Okay, it's broader, far-reaching. Okay, it is you need really to you need really to study. Okay, you need really to apply all your learnings, all your values in your profession, because unlike a technical dilemma, an ethical dilemma is much broader class. Okay. Next, so these are just matters of reading class. I will not read this anymore. Okay. So, put your gaze here. According to this class, to this content, ethics is the study of morality. Careful and systematic reflection on and analysis of moral decisions and behavior. So it really depends on the physician class on how he deals or how he approach the ethical situation. Okay, so remember, ethics is the study of what is right and what is wrong. Okay, it's not really based on technical know-how or technical knowledge, but it is based on virtues, based on values of a person. Okay, so since ethics deals with all aspects of human behavior and decision making, it is very large and complex field of study. Okay, very broad, with many branches and subdivisions. Okay, remember our discussions last time. In every school of thought, there is a subcategory like deontology, Kantianism, and so on and so forth. The focus of this manual is medical ethics, the branch of ethics that deals with moral issues, okay? Moral issues in medical practice. Medical ethics is closely related but not identical to bioethics, whereas medical ethics focuses primarily on issues arising out of the practice of medicine, okay? Arising out of the patient-doctor relationship. Bioethics is very broad subject that is concerned with moral issues raised by development and biological sciences, excuse me, more generally. So last time class, we have discussed the difference between bioethics and medical ethics. So we need not to read this further. Now, let's go to, it begs a question, why study medical ethics? Okay. So as long as the physician is knowledgeable and skillful, ethics doesn't matter. So this came from a school of thought based on technical knowledge, technical know-how. Okay? So that's his point of view. A point of view of a person that his confidence is in his skill. On the other hand, ethics is learned in the family, not in medical school. So this came from a school of thought of a physician who is a family-based person. Okay. Next, point of view. Medical ethics is learned by observing how senior physicians act, not from books or lectures. Okay. So according to this point of view, you learn medical ethics by virtue of experience. Okay. By observing your environment, by observing senior physicians. Another point of view, ethics is important, but our curriculum is already too crowded and there is no room for ethics teaching. Okay? So these are some of the common reasons given for not assigning ethics a major role in the medical school curriculum. Okay? So in other school curriculum class, they give more preference on the technical side of medicine. Okay, the ethical side, sometimes they dispensed with it because it consumes so much time class. However, in the Philippines, ethics is given more weight class. Actually, the ethics subject is applied to all professions, not just in medicine. And even if you become doctors, the continuing education, the large bulk of the credit, ethics subjects takes a large bulk for the credit. Hello? Can you turn off your microphone, class? Okay. Can you still hear me, class? Hello?
Yes, Doc. We can still hear you, Doc.
Yes, Doc.
Okay. So I will continue. So
Yes,
we have discussed that. So take note, class, the study of ethics prepares medical students to recognize difficult situations and to deal with them in a rational and principled manner. Okay? So the study of ethics class really is to hone your attitude. Okay? Hone your character. Now, let's discuss medical ethics, medical professionalism, and human rights and law. Okay. So last time we discussed the essence of what is law, what are rights. So as will be seen in chapter 1, ethics has been an integral part of medicine at least since the time of Hippocrates. So before the Christian era. From Hippocrates came the concept of medicine as a profession, whereby physicians make a public promise that they will place the interest of their patient above their own interest. Okay? So if we can read the Hippocratic Oath, the different principles in medicine are enunciated also there. Okay? So in recent times, medical ethics has been greatly influenced by the developments in human rights. Okay. So these are just matters of reading, class. Of course, human rights plays a vital role in the practice of medicine because your patients has certain rights and obligation also, as well as the doctors. Okay. So that's why human rights plays a vital role in the practice of medicine. Medical ethics is also closely related to law, just like what I said last time in our previous discussions. Sometimes it depends upon the law, okay, of the country. For example, in the Philippines, abortion is illegal, euthanasia is illegal. However, in the other countries, they are accepted. So sometimes medical ethics is dependent on the law of the land. Okay? So often, ethics prescribes higher standard of behavior than does the law. And occasionally, ethics requires that physicians disobey laws that demand unethical behavior. Okay? So of course, ethics being broader topic, broader subject, and sometimes law are very specific and restrictive. Okay? So ethics would demand that if the law is requires a person to act unethically, then we follow what is ethical. Okay? So conclusion of chapter 1. Medicine is both a science and an art. Okay? Because the practice of medicine not just involve theoretical studies, okay, but also skills, which is considered an art. For example, if you are an operating a surgeon, you are a surgeon. Of course, the theoretical side is all the principles of surgery. Okay, all the theories of surgery, all topics of surgery. In the other hand, the side which involves art is the skill involved in the procedure, the surgery itself. Okay, that's why medicine is considered both a science and an art. Science deals with what can be observed and measured, and a competent physician recognizes the signs of illness and disease and knows how to restore good health. But scientific medicine has its limits, particularly in regard to human individuality, culture, religion, freedom, rights, and responsibility. So the approach class, there is no ultimate approach. Okay, it should be a combination. Okay, do not approach a certain disease scientifically, theoretically. Remember, class, in some theories that we discussed, some theories rely on the environment, okay, not just the disease. The human responses of the person, you must treat it as well as the disease in order to fully heal a person. So that's the holistic approach, okay? Not just treat the disease, but treat the responses, the human responses of that disease, okay? Just like what I said, the comforting words and the reassuring words of a good doctor is sometimes better than medicine, okay? Than the medicine given, okay? So in the final analysis class, if you are a patient, what you can remember is not the medicine which is given to you, but the attitude of the doctor, okay? Of course, for example, you will have a stomach ache, and then you went to a doctor, and then instead of course, the doctor gave you the proper medicine, but before giving you the medicine, the doctor scolded you. Why did you eat something like this? That's blah 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 blah. Of course, you will feel mad about yourself or sad because you got scolded. Okay, so as a doctor, you must approach it in a holistic point of view class. So when you say holistic, it involves different aspect, physical aspect, emotional aspect, spiritual aspect, financial aspect, okay? So if you want to be a good doctor, have you seen the movie The Good Doctor? Okay? So you must approach it in a holistic manner. By the way, class, the movie Good Doctor, the doctor has a condition. I forgot, autism. The doctor has autism. Okay? So that's beside the point. Okay? So continue. The art of medicine involves the application of medical science and technology to individual patients, families, and communities. No two of which are identical. Okay, so everybody is unique, class. even though, for example, two persons has the same illness, but remember, how they respond to their illness is different, especially when they are, for example, one is female, one is male. Remember, class, that the male, more often than not, they will not tell the 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 real issue, because of course, because of maybe for the males, it's part of being a macho man, okay? But if you are a patient, class, you need to tell everything to your doctor, okay? Families, communities. So by far, the major part of differences among individuals, families, communities is non-physiological. And it is in recognizing and dealing with these differences that the arts, humanities, and social sciences, along with ethics, play a major role. Indeed, ethics itself is enriched by the insights and data of these other disciplines. For example, a theatrical presentation of a clinical dilemma can be more powerful stimulus for ethical reflection and analysis than a simple case description. Okay, so on how you present the ethical issue, class, or ethical dilemma, sometimes if you can really see the problem, it has an appeal to you compared if you only read it in books, okay? Because like what I said earlier, experience is the best teacher. So if you can see it, you can address it in your senses. You can touch, you can feel, you can taste, okay? You can see, you can smell. Then it has a more appeal to you compared to you just read it somewhere, okay? So this manual can provide only a basic introduction to medical ethics and some of its central issues. It is intended to give you an appreciation of the need for continual reflection on the ethical dimension of medicine, and especially on how to deal with ethical issues that you will encounter in your own practice. A list of resources is provided in Appendix B to help you deepen your knowledge of this field. Okay? So this manual, class, will serve a guideline. So I think, class, you need to, for your self-consumption, you can print this manual for guidance, okay, for your information, because this guideline, class, is used not just here but all around the world, okay, international organizations, medical associations, medical institutions like hospitals, okay. So this serve as a guideline, okay? So that ends our chapter 1. So far, class, do you have any questions or clarifications with regards to our topic?
None so far, attorney.
None? Okay. So I think, class, for now, we end with chapter 1. And then we will discuss further the different chapter next week, because the exam is the week after. Right? Am I correct? Hello, class?
Yes, Doc.
Yes,
Okay.
attorney.
Okay, so if you don't have any questions, I will end this recording. Okay, thank you, class.